periods. So most of the time you hear someone complaining of not seeing their periods at all. It can be 3 months, it can be 6 months, it can be 1 year, it can even be 2 years. So it all depends on how your body and how further your polycystic has progressed to. Some might even complain of excess bleeding 2 to 3 times in a month. Some might complain of heavy bleeding to an extent that they change pampers instead of pads. So you have clothes, a lot of bleeding involved. There is infertility. This affects so many people out there. A lot of them complain about not getting pregnant in the natural ways because of ovulation. There is no ovulation that takes place, so the chances of pregnancies go minimal. We have obesity. I think a lot of women can relate to that, those suffering from polycystic ovarian syndrome. Obesity will give you a low self-esteem, you will feel demoralized, you will try on a lot of diets, a lot of nutrition, but with no benefits. Because polycystic needs a better diet, a better exercise revision. I think my nutritionist here will shed up more light on that. So 3 to 4 women out of 5 suffer from obesity. Excess hair growth, unwanted areas. I think everyone is aware of that. Especially on the chin area, the chest area, the abdomen area. It's something no women would actually want, I'm sure. Cosmetically damaging. Hair loss in wanted areas. So you notice bald patches. A lot of hair loss, a lot, to an extent that you are afraid to even comb, to even wash, because it is too much and it's depressing, because hair is something we value a lot, right? Acne, severe acne that leave mark, that don't go away, oily skin, especially on the nose area, yeah? We have thickened, darkened patches, especially on the neck. You will notice on the frontal area, on the back area of your neck. That is maybe because of the excess sugar in your body. Your body does not absorb the sugar. It goes and deposits on the skin. And of course, the ovaries. Of course, how can you forget the ovaries? Multiple fluid-filled sacs in the ovaries, like I have shown you before. Now, you might be wondering, how does polycystic come about? What exactly causes polycystic? There is no cause. There is no definite cause at all. Science is still trying to figure it out. But of course, many of the times you will notice that those who are suffering from this have someone in the family that have suffered from that. So be it your mother, your sister, it increases your chances of having polycystic ovarian syndrome. But of course, these things were not known before, taking into consideration our medical facilities in the past. So majority of the women went undiagnosed. They didn't know. But if you ask them, did you suffer from irregular periods? Did you suffer from weight gain or infertility? You will have a yes on. But there are no causes that bring about polycystic, but there are some factors that are involved in polycystic ovarian syndrome. So we have insulin resistance, increased level of hormones called androgens, and an irregular menstrual cycle. Now, when I say insulin resistance, many of you might be wondering, what is insulin resistance? Insulin basically is a hormone that regulates our sugar in our body. So when we have insulin resistance, the body glucose, the sugar in the body, does not recognize your insulin. They don't work together. So what happens? Sugar goes up. What happens when your sugar goes up? Your body detects that, okay, she has an excess sugar. Maybe the insulin levels are less. Not knowing that it's not the levels that are affecting, it's the resistance that is affecting. So your body makes more insulin. Again, the insulin does not take up the sugar. Your body detects it. It makes up more insulin. The cycle goes on. Insulin then ends up giving you irregular periods because it interferes with your female hormones. It causes weight gain. Yes, insulin causes weight gain. Excess insulin causes weight gain. We also have an increase of hormone called androgens, the male hormones, the testosterone being in particular. So every one of us has a little bit of testosterone in us. That is why we have the myofascial hair. So it's there. But in polycystic, because of insulin increase, because of the hormones not being in the proper amount that they are required, we have an increase in testosterone. Now that explains why we have abnormal growth on the chin, why we have growth on the abdomen, why we have acne, why we have oily skin. Excess of sugar in the body, again you end up getting those darkened skin patches, sometimes even on the skin. You end up getting a butterfly look. Irregular menstrual cycle is also a very important symptom many of them have in polycystic. That is because there is no ovulation that takes place. So the uterus lining just keeps on shedding, or it does not shed at all. So either you bleed overly, or you don't bleed at all, or you bleed very little, just spots. So the irregular menstrual cycle then brings about infertility. This picture basically sums up what I have been talking about so far. So we have our Miss Uterus here, we have our Mrs. Ovary there, and we have our diet and well, the excess insulin. You know the fatty food that we eat? Yeah, that worsens because, okay? And when there is no diet involved, it goes over the roof, okay? So, excess hair growth. You see that little mustache? It looks cute on men, but not on women, okay? Bald patches. The hair growth is drastic, the hair fall is drastic. That is because of excess testosterone, excess androgens. Then we end up getting acne, we become puffy, we become chubby, and a lot of it. Now the uterus doesn't bleed, or it bleeds very little, just drops, or a lot of bleeding, or no bleeding at all. You wonder at times what happened. Then we have, of course, our ovary there. A lot of cysts, multiple cysts on the periphery, it is inflamed, it does not ovulate. Okay? Of course, treatment options are there. We will come to that shortly. So, I mentioned health risks in the beginning. So, let's talk about a little bit of what health risks are involved. Okay? So, polycystic, when you're diagnosed with polycystic, you have lifelong consequences. Because polycystic is something that is there. It might disappear or it might stabilize, but it always comes back and it's always there. It's just how you manage it. So it has lifelong consequences. Coming to the first one, the insulin resistance. Now, insulin resistance, like I mentioned, high sugar in the body, right? Now imagine having constant high sugar that your body does not take in. What happens in the long run? 5 years, 10 years down the line, what happens? You get diabetes. Okay? The type 2 diabetes. Now, you have